Hello, sir. Hello, ma'am. Thank you for this opportunity to do this presentation. My name is Moise Sarah, and I'm in the one-day MBA program. This is the first week of the April cohort. So we had to focus on customer discovery, which is really an exciting experience that I've had so far. And I'm doing this presentation to talk about my findings, talk about what I found in the field, and how this is going to impact my business. So today I'm going to try to go through the rubric of what has been required for this particular assignment. And the first thing here is about talking about a hunch. What was my hunch when I actually got into this particular space? My hunch was that the medical device space, especially in the chronic device management, is an interesting segment of medical delivery products. And I've done this a while in terms of being a medical device field, but how to monetize it and make it profitable for the business is what I really had to do some deep introspection to be able to find out how to have that niche and to let it become stable. So my hunch was that being that diabetic patients are very, very particular about their care because that is a lifeline, how can I be able to leverage that to my advantage? So here we are, going to the field, finding out if this hunch that I have, that if I'm able to create a niche out of this, is going to help my company. This particular experience and experiment actually was supposed to help me validate that hypothesis. And actually, I think I did. So my hunch was, can this business actually become profitable for my company? Can this endeavor, getting into the medical device company process, especially in the diabetic space, can it profit my business? Yes, I was able to say emphatically through being in the field that yes, it can. So that is my initial hunch. Secondly, the second rubric here, I have to talk about the customer discovery process. In fact, for me, this was amazing. This was actually exciting because when I first started, I was a little, unsure about what to find. I was unsure about how the clients are going to respond to the questions that I'm going to pose. I was very unsure about what answers I'm going to find and how that was going to play into the bigger picture, in the bigger scheme of what I'm trying to achieve. But actually, I found it very amazing that some of the clients are willing to talk. Some of them are willing to give you what their difficulties, what their pain points are, so that you can be able to devise a solution for them. So the process was not as easy as I thought going in, but coming out of it, I think this process was really very wholesome and helped me to have a deeper perspective about what I was trying to achieve. And how many patients, how many customers did I talk to? I spoke to at least 20 customers. And some of these customers, they were just very willing to talk and to engage. And what were we talking about? The questions that I was posing about the product itself. How do they appreciate the product? If I was to provide solutions to their pain points, would they be able to engage with the product? And I was able to really have a very good feedback. So I spoke to a total of about 20 patients, and like I said, the data that I received from this is going to help me a lot to be able to continue to devise my own program in a way that will be suitable for my company. And these 20 patients that I spoke to, they came from a diverse field. So some of them were medical practitioners, some of them were working for NGOs, some of them were the actual patients, some of them were distributors, who are actually interested in selling these products in the long run, and pharmacies as well, which are also distribution points. So that's the whole range of the customers that I spoke to. So the third rubric here is to talk about the pain point. What is actually the pain point and what am I trying to resolve? Like I said from the beginning, we're dealing with diabetic patients. And these patients have a chronic disease. This disease needs to be managed. Bottom line, if you don't manage it, you die. If you don't manage it, you develop complications. So they are very, very sensitive to their diabetic testing kits. These strips that they use on a daily basis to check the ranges of sugar in their bloodstream, it is what they most use, whether when they eat or after when they eat, to see how their sugar levels are actually operating in their bodies. So their pain point is that they want to make sure, absolute sure, without an iota of doubt, that the strips that they use to test themselves every day is available. That availability, it's actually the niche that I found, going into the field. And the point is that when I spoke to these patients, some of them, their biggest pain is that they have the meters, they want the strips to be able to do their testing, and sometimes they cannot find the strips because the distributors of these strips, sometimes they just don't make them available on time, so they have a lapse, periods upon periods where they cannot test because they cannot find the strips. So they want to absolutely make sure that whatever meter they are using, they are able to have access to the strips. That was a very important pain point. The second pain point I found was the price factor. Some of them, they don't have the buying power that others have. So they want to find out, can they have a reliable system that they can be using but at a more affordable price? So that is also an important pain point. The third pain point that I found was the logistics. Some of them have to go to long distances to buy the strips. If the logistics was brought closer to them in such a way that they can access the buying of the strips very easily, I think they will be happy to have that. So these are some of the things that we actually found as pain points, and also the quality component. They want an affordable product, but they also want it to be qualitative. So I found out that if we are able to give these patients all of this, then I think our niche will be validated. So that is the pain points that I actually found. So what are the solutions? What are some of the solutions? So after gathering all this data, after talking to all these people, what I did, came back, reflected on it, and even spoke with my mentor about what I found out, which was an exciting exchange. So speaking to my mentor, we came to certain resolutions of what the solutions can actually be. The first thing, and this one came from my mentor, not from me, he said, can you actually provide a subscription-based model? So a subscription-based model in the sense that when I can have them in my database, I can have some kind of a relationship with them that says that every month on this particular predetermined day, I will deliver this product to you. In that way, they have peace of mind. They don't have to worry. They know that on the 28th of every month, for example, somebody is knocking on their door, somebody is giving them their product, no questions asked, and so on. So the subscription model was actually one of the things that was discussed. The second thing that we discussed is, how can I bring this product closer to the patient? So we spoke about having distribution points all over, so that even if we were not there to deliver to them, they can walk to a local pharmacy very close, get their product, and they're out of there. So those are some of the solutions that we spoke about. And then the next thing we spoke about is, can I provide them free meters? So for example, maybe they had another competitor, they had Accu-Chek, or some other code-free, some other product that they're already using. How can I bring them to my fold? I can give them free meters. Just say, this is free for you. Come on, let's work together, make sure that you always have strips and so on. So that was, in fact, I've already tested that hypothesis and it's already working, because some of them are actually coming to me already. The third solution that we had to be able to drive the market and own the market and control the market and have a say in the market was, can we add value to their purchasing power? So for example, now, averagely, every pack of strip is 50 strips in the box. Can I make it 60? Can that be the EasyCheck, La Pro Pharma, my company? Can that be what I offer as value to my customers? Give them more strips so they can be able to say, you know what, maybe I can keep a little bit more strips, and in the long run, I will save a whole month of supply, So that is value added to their purchasing power. So we discussed that, and of course, I discussed with my factory, and that seems to be something that we can do. And then the other solution that we bring into the fore is the aspect of robust logistics. Like I said, making sure that we have our agents, our representatives, our salespeople, that they are ready at every given time. They can go to the house of the patient and deliver the product. Then the last thing that we discussed as a solution, which came out of the pain point, of the customers, is, can we be able to have an after-sales support system? So you have sometimes, some of these diabetic patients are elderly, they cannot really manipulate the meters very well. Can we go to the homes and teach them how to manipulate it so that they can comfortably sit in their home and take their blood glucose meter readings. So we said that that's one thing we're going to do, and actually we are in the process of doing that. So the third thing, the other aspect that we have to talk here is about value proposition. Like I said, my brand is EasyCheck, my company is LabPro Pharma. So what kind of value proposition are we bringing to the patients to make them realize that this is a very serious product for them? The first thing is precision. We're telling these patients that, you know, we are going to deliver to you what is precise. We're delivering to you what is clinically proven by data. We are delivering to you a product that is certified. So we have the ISO standards that, you know, we use to validate the quality of a product. We have the CE mark certificate to show. And of course, the product that we are delivering in this market is FDA certified. So we are giving them that as the precision, something you can actually trust, you know, and so on. Then the second value proposition here is affordability without compromise. So, like I said, we're trying to see how we can drive down costs for the patient. The purchasing power here in the Democratic Republic of Congo, where I'm running this particular segment, is very low. So how can we drive down costs? Like I said, we've reduced the cost through the subscription model. They are able to earn points. They are able to earn some kind of a discount, you know, month after month, so that at the end, what they are paying for is actually less than what they will buy from our competitors. And then the third thing is our product is designed for local realities. What you can have here in Congo may not be what we have in France, may not be what we have in Iceland, may not be what we have in the United States or Canada, because the temperature is different, the realities on the ground are different, the handling procedures of the product are different. So we've taken all of that into consideration. And what we are doing is we are delivering a product that can work in the environment in which the patient resides. Then the other value proposition is ongoing support and replacement. Like I said, we've put it into our system in such a way that if you have a problem with your meter, bring it to us, we take it back, we give you a new one, no questions asked. If you don't have a meter, come to us, we'll give you a meter free of charge, no questions asked. All we ask is for you to be loyal in buying your strips month after month. So that ongoing support is there. And secondly, the fact that we are training our medical delegates in such a way that they can help the patient even in their home in terms of helping them manipulate the device. So that is added value to the proposition we have. The next one is a trusted distribution network. So we are talking with pharmacies, we are talking with distributors, we are talking with different sales points on the ground to bring the product closer to the patient. We are bringing the product closer to where they live so that accessing the product is not a problem to them. So as you can see, we have a distribution network, whether it is, like I said, the pharmacies, or even in some cases we're talking about the diabetic centers where they go for care. We're trying to talk with all these people so that we can be able to leave products there for the patients to be able to buy. The next thing we're talking about is empowering the healthcare providers. So again, through education, through telling them, you know, how to use these meters, how to be able to read the blood sugar levels and so on and so forth. We're educating them about the disease that they are suffering from so that they can have, you know, better care and be able to live in a more healthy way. So those are some of the things that we have accomplished through this customer discovery process. Like I said, it has been an amazing process. It's been such a learner-centered approach that we took. It's been something that is eye-opening. It's been something that has given us enough and sufficient data that we can use to become the number one. The choice here is between failing and become the number one. And we are not about failure. We are about becoming the number one. We are about controlling this market. We are about, you know, putting our brand out there in such a way that when people see it, when they hear about LabPro Pharma, they hear about EasyCheck, they know exactly what they get. They get value, they get quality, they get good pricing, they have good customer service experience from us and so on. So this is what we have to offer. The process has been amazing. We have incredible data to work on. We are analyzing the data. We are we're trying to put it into practice. We are practicing it, we are running it, we are testing it and so on. And I feel like at the end of this process, we are going to meet our objectives of actually adding value to the life of every diabetic patient in Congo and beyond. So thank you very much for this opportunity for me to present what I have found in the field, and I hope the learning process in One Day continues in such a way that we can become very proficient in what we do and we can become very successful in our business. Thank you. Goodbye.